The county is in the middle of a survey with ASU and the Mayo Clinic to get a complete and accurate picture of how many people are infected.
And one question that we're hearing, Chris, time and time again is where are people getting infected? What places should we be avoiding? Of course, we've all heard the warnings about crowded bars and gyms. Our government health officials have not released much, though, in the way of details about coronavirus hotspots. So our chief investigative reporter, Morgan Lowe, is asking that important question tonight. And Morgan, you found some pretty frustrating information.
Yeah, Heather, it's frustrating because the state and county health departments have this information. They're literally sitting on a treasure trove of data about where people are getting sick, but they don't think you have a right to see it.
Today's executive order will pause the operation of bars, gyms.
Last week, Governor Doug Ducey closed down bars and gyms for 30 days, arguing that those are the places where young adults are likely to catch COVID-19. But how does he know for sure? County health departments across Arizona reach out to people who come down with the disease, and they ask, "Where have you been?" But why don't they publish that data?
I understand why people want to know where people are getting COVID-19.
Dr. Rebecca Sonnenschein is Maricopa County's medical director for disease control. During a news conference today, she said the specifics of where are not important anymore because the virus is everywhere.
What we're asking people to do is know that every time you step outside your home and go within 6 feet of another person who's not in your household, wear a mask.
But there may be value in knowing where. What if most people are catching it at family parties or at the supermarket or at the gym or bars, as the governor argues? Is it possible that you could release some of that information if, in fact, you take into account the point of contact?
The place where you are most likely to get infected with COVID-19 are places where people are spending time in groups, typically of more than 10, certainly more than 50, where people are within 6 feet of one another, not wearing masks, eating, drinking, talking, singing.
Right now in Arizona, patients are getting mixed messages. We've got gyms that are closed, we've got bars that are closed, and yet indoor dining and restaurants are open, casinos are open.
Dr. Natasha Bouillon sees patients every day and hears their questions. She argues that information about where people are getting infected is critical for people to make informed decisions about where they should and shouldn't go. And it would help officials like Governor Ducey convince a state that some businesses and places need to get shut down and others don't.
If it's based on science and evidence, that's one thing, but we don't have transparency into the contact tracing data, so we're not able to make any decisions.
And as of today, the state and county health departments are not releasing that information. I asked that question twice during today's news conference, and the best answer I got was that statement about being in crowded places and breathing other people's air. But we're going to continue to try to get this data. Chris, back to you.
Morgan, I heard you pushing during the press conference trying to get answers. Did they say why they don't release it? Information is what people need right now. Did they say why they're not releasing it?
They have not given us a good explanation as to why. And we actually, and some other news organizations, took the state to court a couple of months ago to try to get specific information about the senior care facilities where they were having these hot spots. And the state would not release that information. Here, we're just asking about general spaces. Is it supermarkets? Is it family parties? And they're not willing to give us that.